Hi, my name is David Black. I'm a physical therapist at Orthopedic Rehab Specialists, and I'm going to talk a little bit about rotator cuff injuries today. Why is the rotator cuff an important muscle group in the shoulder? Well, the main reason is that the shoulder is an inherently unstable joint. It's like a golf ball on a golf tee. There's not a lot of what we call static stabilization in the shoulder. The shoulder is the most commonly dislocated major joint. The angular velocity at the shoulder is about 7,000 degrees per second. So what exactly is the rotator cuff? Well, the rotator cuff is made up of 4 muscles. 3 posterior, meaning in the back of the shoulder, 1 anterior, meaning in the front of the shoulder. The 3 posterior rotator cuff muscles are the supraspinatus, the infraspinatus, and the teres minor, and the anterior rotator cuff musculature is called the subscapularis. The 4 muscles of the rotator cuff function as an isometric unit, meaning that they take the head of the humerus and they compress it into the socket so that the shoulder can function appropriately. The rotator cuff muscles work in 3 main ways. 1, by creating joint compression as we just described. 2, by blending into the shoulder capsule. It provides a tensioning effect on the capsule which stabilizes the shoulder. And 3, it creates proprioceptive input, meaning it gives the brain signals as to where the shoulder is in space to allow for it to react to different positions it's being put in. If you sustain a serious shoulder injury, you will probably be referred to an orthopedic surgeon who will evaluate your shoulder and possibly do an MRI to diagnose a rotator cuff tear. If you're diagnosed with a rotator cuff tear, you will probably be referred to physical therapy. The literature supports 3 months of physical therapy prior to making a decision as to whether surgery is indicated. Another question that I often get is, if I have a torn rotator cuff, is it going to heal? The answer to that question is no. The next question that I usually get immediately following that is, if the rotator cuff is not going to heal in rehab, how does it help? And if you remember earlier, the rotator cuff muscles are made of 4 muscles. If one of those muscles are tore, we can rehab the other 3 and try to compensate for the tear in the rotator cuff. The rotator cuff originates from the shoulder blade, and the muscles that run from the spine to the shoulder blade also provide significant stability for the shoulder. By maximizing all of the normal biomechanics and the normal muscle length tension relationships of the shoulder, we can overcome a tore rotator cuff a lot of the time. If your physician decided that a rotator cuff repair is needed, what can you expect? You'll usually recheck with the appointment with the surgeon right after the surgery to check the status of your shoulder. Within 1 to 4 weeks, depending upon the size of the tear, you're usually referred over to physical therapy to start range of motion. Passive range of motion, which means a physical therapist is moving your arm, you are not using the rotator cuff muscles to move your arm, will start fairly immediately, again depending upon the size of tear, but anywhere again from 1 to 4 weeks. We usually start with active range of motion, meaning that the patient starts to lift their arm on their own somewhere between 4 and 8 weeks, again depending upon the size of the tear. The physician will usually put you in a sling and an abduction pillow, which keeps the arm a little bit away from your side for anywhere from 4 to 8 weeks, usually 6 weeks. Once your active range of motion is improving significantly, we will start to add what's called a PRE program, or progressive resistive exercises. We will initially use the weight of your arm coming up against gravity, progressing to dumbbells and to tubing exercises, and that continues from anywhere from 6 weeks post-op on to about 3 months post-op. We'll start close connect chain exercises, meaning weight-bearing exercises on the upper extremity, at approximately 12 weeks. We start initiating throwing anywhere around the 16-week point, and you will usually return to sport anywhere from 5 to 7 months post-op, again all size dependent with regards to the tear. If you have any additional questions, you can contact us through our website at orspt.com.